In 1975, Bill Shapiro published a curious article in the New England Journal of Medicine. It concerned how best to administer chemotherapy into the cerebral spinal fluid. He carefully measured drug concentrations after administration through a lumbar puncture. He found erratic distribution, varying more than tenfold, and sometimes the drug didn't get into the spinal fluid at all. It leaked out into the extradural or subdural spaces. He then repeated the same measurements using a subcutaneous intraventricular access device, commonly known as an Ommaya. Each time the Ommaya was used, reliable drug delivery was achieved. Since then, the Ommaya has been commonly used to give drugs into the spinal fluid, whether to treat infections, to kill tumor cells, or to prophylax against the spread of leukemia or lymphoma into the central nervous system. Techniques for Ommaya access vary widely, so we've prepared this video to demonstrate what we believe are the basic fundamental tenets of good technique. It is a rough guide and is not meant to be comprehensive. In fact, our target audience are experienced clinicians who feel that they have already mastered the technique. Perfecting this technique requires practice, observation, and continuous self-improvement. We hope you enjoyed the video, and we want you to return to it frequently. These are the materials used to access the Ommaya. The smallest butterfly needle should be used. This butterfly needle is 23 gauge. A three-way stopcock will be attached to the needle, and these two 10 cc syringes will be attached to the stopcock. Syringes larger than 10 cc's are unnecessary. The gauze will be infused with betadine and then used to thoroughly clean the Ommaya site before access. Once the spinal fluid is removed, 4 specimen tubes are available to send the CSF to the laboratory for analysis. 50% alcohol fixative is immediately available for more accurate cytology determinations. Labels are provided to immediately mark the cerebral spinal fluid accurately. At the end of the procedure, a Band-Aid will be applied. Thoroughly clean the skin overlying the reservoir with sequentially smaller applications of betadine. Connect 2 10 cc syringes to a butterfly needle using a 3-way stopcock. This stopcock allows for differential sterile flow through each syringe. Use the smallest available needle, such as this 25 gauge butterfly. With one quick motion, pass the needle through the skin, the silicone reservoir, down to the hard plastic backing below. Draw spinal fluid slowly into the upright 10 cc syringe. Once this syringe is full, rotate the stopcock to the off position and withdraw an additional 10 cc's of CSF into the second syringe. Remove the first syringe and send this fluid for analysis. Before connecting chemotherapy, perform a timeout, verify the patient's name, date of birth, and that the drug is suitable for intrathecal administration. With the stopcock in the off position, attach the chemotherapy syringe. Rotate the stopcock so that it is open to the reservoir. Rotate the entire apparatus to reduce air entry into the system. Tap the chemotherapy-containing syringe twice. Administer the chemotherapy slowly over 2 to 3 minutes. No resistance to flow should be encountered. Through the Ommaya reservoir, chemotherapy enters the lateral ventricle, is carried to the third and then the fourth ventricle, where it exits at the base of the brain. It is carried down the spinal cord and comes back up through passive flow over the convexities of the brain. Set the stopcock to the off position towards the reservoir. Withdraw spinal fluid from the second syringe into the empty chemotherapy syringe. Rotate the stopcock and use this 5 cc's of fluid to flush the chemotherapy through the chemotherapy syringe, the stopcock, the butterfly tubing, the reservoir, and into the intracerebral ventricles below. The flow should again be over 2 to 3 minutes without encountering any resistance. A total of 10 cc's of fluid is administered in this fashion. 20 cc's was removed for a net loss of 10 cc's of intracranial volume.